Hi everyone, thanks for joining us on Facebook Live today. My name is Emma and I'm a marketing supervisor here at Regenexx Cayman, and I'm very pleased to welcome one of our visiting physicians today, all the way from the Southern California Orthopedic Institute, Dr. Blecher. So thanks for your time today.
Thank you. Hello everybody.
And Dr. Blecher specializes in athletes care and was recently, I believe, named one of Los Angeles' top doctors by Los Angeles magazine. So congratulations.
Thank you.
So today we're going to be discussing the use of blood platelets and stem cells for treating ligament injuries in athletes. And for those of you who don't know very much about Regenexx Cayman, Regenexx Cayman is an orthopedic stem cell institute based right here in Grand Cayman, and we offer advanced stem cell and blood platelet treatments as a sort of non-surgical alternative for people suffering from severe orthopedic joint issues and injuries such as arthritis, ACL and meniscus tears, degenerative disc disease, cartilage damage, and a whole host of other conditions, really. So as you can imagine, we treat quite a lot of athletes here from all age ranges and competition levels, which is why we're glad to have Dr. Blecher here to discuss that with us. And if you have any questions for Dr. Blecher today, please drop them in the comments and we'll try to answer them live. Or if you're watching on playback, we'll be sure to come back to you in the future. So before we get started, Dr. Blecher, perhaps you can tell us a little bit more about yourself and how you came to work in regenerative medicine.
Sure. So I was trained originally in primary care sports medicine. I did a sports medicine fellowship at the Cleveland Clinic in Ohio, where I had the opportunity to work with a lot of professional athletes, including the Cleveland Browns, the Cleveland Indians, the Cleveland Cavaliers. And after that, I moved to Los Angeles and I started working at the Southern California Orthopedic Institute, where essentially I practiced non-operative orthopedics and sports medicine. I started there in 2003 and have had the opportunity to work with a number of different athletes from all ages, youth sports, little league, up through and collegiate athletes, and then elite and professional athletes as well. A lot of what I do includes prescribing physical therapy, bracing, casting, various types of injections. And for many years, we were somewhat limited to that in terms of our treatment. And then regenerative medicine started taking off probably around 2007, 2008, 2009. Started doing PRP treatments, mostly for overuse injuries. There was some evidence that it helped athletes with tendinopathies, and realized there were other potential indications to use PRP. We started using it for ligament injuries and eventually cartilage injuries, and then we expanded to using stem cells, which are even more effective. So regenerative medicine has become a pretty good sized part of my practice now for treating athletes and non-athletes.
Fantastic. So you touched there on like our main topic of the day, ligaments, but perhaps for anyone listening at home who may be unsure, like what are ligaments? What do they do? Where are they in the body? And how do they kind of work with the cartilage and muscles in our body?
Yeah, so ligaments are connective tissue that connect bones to each other, joints. So they provide stability for a joint. They're not the only things that provide stability for a joint. Your muscles also provide stability. So when muscles contract, they will stabilize the joint. When muscles are relaxed, they're not stabilizing the joint. So we call muscles dynamic stabilizers. Whereas ligaments don't have the ability to contract, so they're always taut, kind of like a rope, and they provide static stability to a joint. So they kind of work together to provide support for a joint. When your muscles aren't doing a good job, there's more stress on the ligaments, and the ligaments can get injured.
And what is it about sport that can be particularly damaging to ligaments?
Yeah, so ligament injuries tend to happen for two different reasons. You can either have an acute injury, which oftentimes is from a trauma. You're playing football and you get hit on the side of your knee and that can damage a ligament. Or if you're running in one direction and then you twist really quickly and pivot and cut to change into a different direction, that can put a lot of stress on the joint, so that can give you an acute ligament injury as well. So ligament injuries in sports oftentimes are these acute injuries from a misstep or twisting your ankle or getting hit by another player. But we can also see chronic injuries as well, where there's overuse. So for example, in baseball, people who throw a lot, pitchers specifically, when your muscles are starting to fatigue, again, there's more stress on the ligament starts to break down, we can see a chronic ligament injury.
And are there any sports injuries that you see yourself treating more than others, like, or more frequently?
Knees and ankles and shoulders are typically what we see the most of in sports. For ligaments specifically, however, I would say knees are probably the number one, especially with sports like football and soccer, a lot of twisting and contact injuries, basketball as well. And then we see a lot of ankle injuries. Ankle sprains are very common. That's a ligament injury, and those can be treated with PRP. So we see a lot of those. And then when it's baseball season, lots of throwers and lots that oftentimes lead to Tommy John surgery. Hopefully, and treat them with PRP or stem cells.
Hi everyone, sorry if you were just watching us live on Facebook. We did lose signal for a second there, but we have had some questions come in while we were offline, so we'll just jump straight back into those before continuing our live Q&A with Dr. Blecher. So one question said, my friend is having the plasma treatment next week. He's having it on his left shoulder, neck, both knees and right ankle, so quite a lot of joints. He's been in quite a bit of pain since November. What can you expect immediately after treatment from stem cell treatments, from plasma treatment, sorry?
Yeah, so PRP is somewhat pro-inflammatory. So remember, the inflammation process is the healing process. So initially after treatment, we'll see the inflammatory response. So there will be pain and swelling. Usually tell patients they're going to feel worse before they feel better. Oftentimes it depends what structure we're actually injecting. Some structures hurt more than others. So injecting a muscle may not hurt nearly as much as injecting something like a meniscus. As opposed to just knowing which joints were treated, knowing which structures gives you a better idea of how much pain to expect afterwards. But usually the pain is not too bad and not for too long. Often we'll give patients pain medication just for a day or two. Usually Tylenol is enough after that. We want them to avoid ice because we don't want to, again, reduce that inflammatory response. So they usually have a little bit of discomfort for the first week or two at the most. And then we try to get them into some type of rehabilitation process. Again, depends on what structures we're treating in terms of how long they need to rest, but usually we'll start with strengthening and range of motion as soon as we can. In certain instances, we keep them non-weight bearing if need be for a short period of time. And then usually by 8 to 12 weeks, they've made significant improvement. A lot of these structures heal fairly well in 8 to 12 weeks.
Great. And a second question we had while we went offline was, how important is it to wear the metal braces after stem cell injections in the knees versus a sleeve knee brace? So kind of the metal brace versus the...
Right. Again, it depends specifically what we're treating. So if we're using stem cells to treat in the knee, if we're trying to inject these stem cells where the cartilage is breaking down, and we don't want to disturb those stem cells immediately. So after the procedure, we'll try to unload the area that we injected. So meaning that when you're walking around, you don't want to just squish away all those stem cells. So we use a special type of brace to push the knee over from one side to the other to unload the specific part of the knee that we just injected. So again, depends on which structures we're injecting as to what type of brace is required. But oftentimes we do want to unload one part of the knee for a good 4 weeks after a procedure.
So you possibly recommend the stronger brace if you'd like to see, like, the stem cells do their job in the best possible way.
Correct.
Yeah. And so we have just had another question come in. How long does it typically take for results from stem cells injected into a spinal disc?
Again, depends on the indication. There are very few indications for using stem cells into a disc, and we're learning more and more about how to use that. A lot of the treatments that we do are PRP based in the spine. But again, it depends on how you determine results. Immediately after the procedure, there's going to be a lot of discomfort, and patients, might feel a little bit worse before they feel better. It takes just a while to heal, and for that inflammatory process to kind of calm down. So it may be several months before there's significant improvement, although some patients do feel better, within a couple of weeks.
Yeah, and Ryan, we'll drop you a message after this, just with our outcome data for spine treatments as well. I think that might be very useful for you. And if anyone else has any specific joint outcome data requests and you'd like to see how those joints feel after 3 months, after 12 months, please drop us a message and we'd be happy to show you our infographics. So getting back to the questions about ligament injuries in athletes. We got cut out as you were finishing off talking about PRP and how that helps ligament injuries, but how is it that stem cells comparatively can help ligament injuries?
Right, so we talked about PRP. One of the major functions they have is to recruit stem cells to an area, which requires adequate blood flow for the stem cells to be able to reach the injured tissue. So in certain injuries, there really is not adequate blood flow to the area, so your body's own stem cells can't get there. So when we do stem cell treatment, we're getting over that hurdle by taking your body stem cells and putting them right at the site of injury. So some injuries such as ACL tears or UCL tears in the elbow, or specific ligament injuries like an injury to a meniscus or labrum or articular cartilage have very little, if any, blood flow to them. So PRP on its own doesn't work very well. So we need to combine the PRP with stem cells, put both of them in the exact location of the injury in order to get tissue healing.
How is it that Regenexx I suppose you spoke there about like the difference between the two. So what's the main deciding factors between someone, a Regenexx physician, choosing to recommend PRP over stem cells?
So specifically for a ligament injury, for the more mild ligament injuries are often referred to as sprains. So it's a grade 1 or 2 sprain or ligament injury. Oftentimes we can treat that with PRP because there still is adequate blood flow. A lot of the overuse chronic ligament injuries can be treated with PRP as well. For the more severe injuries, the grade 3 injuries where you have a complete tear or rupture of the ligament with no structure left or no blood flow to the area, then PRP alone is not going to work very well. Another situation is even if there's just a grade 2 injury, but the ligament is very loose, so oftentimes we can test the ligament while we look at it under ultrasound and see how loose it is. And if the ligament is extremely loose, that may not be a good candidate for PRP either, and we may need to decide that we need to use stem cell therapy. So for a lot of ligament injuries, we can get away with PRP alone, but for some, we need to jump straight to doing stem cell treatment.
And what are your, are there any injuries then that we can't necessarily treat with stem cells or blood platelets? And what are your thoughts then on treating certain sports injuries with surgery?
Right, so there are some ligament injuries where the ligament is completely torn and the ends of the ligament have been pulled apart and there's kind of nothing left in the middle. And without any structure there at all, it doesn't really matter what we inject into an open space, we're not going to get any tissue healing. So in those instances, PRP or stem cells don't work very well and surgery would be required. So for example, an ACL tear is a common ligament injury that has always been treated surgically. There are some ACL tears that we can treat with PRP and or stem cells, but if the ligament is completely torn and pulled apart and the ends aren't close to each other, then surgery would be the only option.
Right. And what sort of results I know it's quite general and every patient is different, but what sort of results have your patients experienced from the Regenexx treatments on ligament damage?
Yeah, patients do very well. We are careful about choosing the right patient. We don't want to give patients unreasonable expectations that we can cure everything because we can't. There are certain things that do require surgery, but if you choose your patients correctly and we do appropriate treatment where we're providing the right treatment, either PRP or stem cells or a combination of both, and we treat accurately with some type of guidance, either fluoroscopy or ultrasound, then patients generally have very good outcomes. Oftentimes, when we treat athletes, we have a hard time holding them back. They always want to get back to sport quicker than you'll let them. So that oftentimes is a challenge, but if they do the appropriate rehab, you have a very good success rate. A lot of the injuries that we treat with PRP or stem cells make a complete recovery and go back to elite level athletics.
Great. And we've had another question come in. What is the benefit of Regenexx bone marrow stem cells as opposed to umbilical mesenchymal stem cells?
Yeah, so there's a lot of debate about that now. We've been using bone marrow stem cells for a long, long time. And if you go on our website, you'll see all of our outcome data. So it's been very well researched. We know what the outcomes are. There have not really been any outcome studies on using umbilical-based products. It's kind of the new fad now. Unfortunately, it's not very well regulated. If you see a physician who is offering you this, ask them to see what their outcome data is, because I'm sure you'll be surprised to see that they have none. So right now we stick with what we know. We get good outcomes with bone marrow. In the future, I think there potentially is promise for umbilical or placental or amniotic-based therapies, but we're not there yet.
Yeah. And is there an impact on bone marrow mesenchymal stem cells if you're aging, if you're a little bit older already?
Yeah, so our bone marrow mesenchymal stem cell counts are good until we get into our 50s, and then they slowly start to decline. A lot of it depends on your health status as well. Healthy diet and being active will support your stem cells. If you've got heart disease or diabetes or hypertension, those things can affect your stem cell counts as well. So certainly the younger and healthier you are, the better your stem cell counts are. Obviously, a lot of the athletes that we treat tend to be on the younger and healthier side, so we get very high stem cell counts.
Yeah, but then I suppose that's one of the advantages of what we offer here as well with Regenexx and the culturing process. So would you be able to talk a little bit about that?
That's one of the benefits of doing the cultured stem cell therapy is that we're able to culture out stem cells. We can get up to 1,000 times what we can get without culturing. So in patients who need to treat multiple joints or may not have very high stem cell counts, we can get around that by culturing out their bone marrow and getting very high stem cell counts. Usually we have plenty left over that we can save and use for future uses.
Yeah. So a little bit earlier you discussed the kind of acute and chronic differences in ligament injuries. How is it that someone might be able to tell if they're suffering from acute versus chronic? And is there actually, I think you touched on it a little bit before about how we choose to treat them differently.
Yeah, so acute injuries, typically you'll know when that happens. So you sprain your ankle, or you twist your knee, or you get hit playing football, you'll have acute pain and swelling. You'll know when an acute injury happens. And typically these acute injuries, if they're going to heal on their own, will heal in about 8 to 12 weeks. So if they haven't healed by then and you've got chronic pain that's persisted for months and months and months, it may at that point be a chronic injury. The other type of chronic injuries we see are the overuse injuries, as we talked about, especially with throwers are a good example. So if you're a pitcher and you kind of slowly start to develop elbow pain over time, you don't recall there was an acute episode where you threw once and felt sudden pain, but have developed pain over time, that may be a chronic ligament injury.
We've had a question come in again. I already did PRP and bone marrow stem cell treatments for a degenerative disc. It's been 3 months and I'm still in pain. And we've said the results can take some time, but still can't move as naturally as I used to. My question is, does Regenexx Cayman provide a choice of more potent stem cells since legislation is different from the US? I suppose that's, again, discussing the kind of Regenexx implications.
Right, so the benefit of the culture treatment that we can do here is we can get many more numbers of stem cells, so our stem cell counts are much higher. The other benefit is that we can actually isolate the stem cells when we treat in the US. We can't actually isolate the stem cells without culturing them out. So we're really using something called a bone marrow aspirate concentrate. So although what we're injecting contains stem cells, there are other things in there as well, blood products and precursors, which can be very pro-inflammatory and cause discomfort. So here in Grand Cayman, we can get rid of all those other unnecessary cells that we don't need and reduce that inflammatory component, which can cause a lot of discomfort. So there definitely are a lot of benefits to treating here.
Yeah. So a little bit earlier you talked about the kind of advantages of the fluoroscopy, the ultrasound, that image guidance, which we do here. So a lot of other stem cell clinics don't use these techniques, whereas Regenexx doctors are trained in ultrasound and fluoroscopy image guidance to ensure accurate injection placement during procedures. But perhaps you can talk about the kind of difference this makes in terms of treating sports injuries. What does that image guidance do?
Yeah, it makes a tremendous difference. So, a lot of things that we have treated in the past using something such as corticosteroid, the steroids are kind of like hand grenades. As long as you get close, they work. You get them in the genital area and they'll reduce inflammation and reduce pain. But when we're treating with orthobiologics like PRP and stem cell treatment, it's really important that we're injecting those exactly to the site of injury. So the platelets and the stem cells need to interact with the damaged tissue. They can't be close. They need to be exactly at the site of injury. So stem cells have the ability to stick to tissue, so they'll come into contact with tissue and they'll stick to it. So if the first tissue they come into contact with is not the tissue you want to treat, then you've wasted your stem cells. So it's very important that we get the treatment exactly to the site of injury, which is why we use guidance, whether it's fluoroscopy or ultrasound. We want to make sure that we're putting the needle in the exact spot and actually see that the fluid we're injecting is going where we want it to go.
Yeah, definitely. So moving a little bit away from the kind of ligament injuries, perhaps we can talk about arthritis in sport. I suppose if people are suffering from arthritis, they might be put off practicing sport. It might be painful or uncomfortable, but despite the pain, isn't exercise good for athletes? Like, is that for arthritis? Sorry. And what's your advice for people in this situation?
Yeah, we see a lot of arthritis in athletes. People tend to conceptualize arthritis as a disease of older folks, and that's not necessarily the case. We see younger and younger people developing arthritis. A lot of people who have ligament injuries, like tearing their ACL, for example, will develop arthritis, and sometimes they can develop arthritis within 5 to 10 years. So if you think about the, quote unquote, epidemic of ACL tears that's occurring in young athletes, age 15, 16, 17, within 5 to 10 years, they may develop arthritis in that joint. So we'll see patients in their 20s and 30s with arthritis. And particularly since people are more athletic at younger ages, they specialize in one particular sport and play it year round. Once you've injured a joint and you continue to pound away at it, you'll break down your cartilage, and we'll see these arthritic changes occur fairly early. So we are seeing a lot of athletes with cartilage damage and arthritis, and that's something that we do need to treat. And PRP and stem cells provide great promise for that. When we have cartilage injuries and arthritis, we tend more to use stem cells with PRP as opposed to just PRP alone. And we see good results, especially in younger patients. Before their cartilage is broken down, what I always tell patients is we can't really grow back all the cartilage you've lost. So if we can treat it early before the cartilage has all gone away and it's kind of in the earlier stages, we can really do the athlete a great service. So treating these earlier and earlier and younger with good results.
Stuff. And going back to your professional career, so you've treated a lot of professional athletes, and is there, perhaps no naming names, but is there any particular case that's left a lasting impression on you on just how successful like PRP and stem cells can be for an athlete's career or their career longevity?
Yeah, it's always great to see an athlete get back to the sport they love. I've been an athlete myself my entire life, and I've had lots of injuries and a few surgeries, so I know what it's like to be out of the sport you love. So anytime we can get an athlete back onto the field and participate at a high level and prolong their career, it's a great thing. And we see that a lot. One of the most memorable, probably, however, is going to be a little bit different than your typical athlete. Obviously, I practice in Los Angeles, and being in Hollywood, we treat a lot of people in the entertainment industry, and a lot of people in that industry are athletes themselves. We treat a lot of stuntmen, and stuntmen really beat up their body and do a lot of damage the way a lot of professional athletes do. So we do treat a lot of stuntmen, and we use PRP and stem cells. And one particular case I had was a stuntman who had torn his ACL, and he was a stuntman for a major motion picture, and he was part of the original movie cast, and they were doing the sequel, and he very much wanted to reprise his role as the stuntman for one of the leads in the film, but they were set to shoot in about 12 weeks, and he had completely torn his ACL, and if he had gone the typical route of having an ACL reconstruction, then there's no way he would have been able to participate in the film, as the recovery from ACL reconstruction is at least 6 months. So he didn't have that kind of time, so he was looking at other options. So we decided to pursue stem cell treatment for him, and we were able to completely heal his ACL within 12 weeks, and he got back out on set and performed all kinds of stunts, running and jumping and falling off of buildings and crashing cars, and he did great. And
on purpose, though, right?
On purpose, yeah. And he was 40 years old. And he was out there, performing like a professional athlete. And unfortunately, I think it was a year later, he was injured on set. He was hit by a car and injured his knee again. This time he injured his meniscus, but we ended up getting an MRI to see the new damage to his knee, and the torn ACL that we had originally treated still looked perfect. despite
Amazing.
beating it up and despite getting hit by a car, his ACL was fine. He injured his meniscus, but his ACL was fine. So
Yeah.
it's been pretty impressive.
Amazing. We've had another question come in. Will it be uncomfortable to travel or fly 2 days after treatment? Is it safe to fly?
It is safe to fly. It might be a little bit uncomfortable. Again, depends on what structures we're treating. Some structures are more painful than others immediately after the procedure. So that's some advice you should get from your physician as to, based on what structures are being treated, how much discomfort you'll have. But we do have patients all the time who fly within a day or two of treatment.
Yeah. And just in closing, how can people better take care of their ligaments? How can they keep them healthy and injury-free?
Yeah, well, unfortunately, the nature of sports is people get injured, and a lot of ligament injuries tend to be acute injuries, which are unpreventable, especially in contact sports. But there are injuries that are preventable, and those are the chronic overuse injuries, especially the throwing injuries, as we discussed in baseball. Remember that the muscles provide stability to a joint. When your muscles are fatigued and they're not doing their job, then there's more stress in the ligament, and that's when you're going to injure your ligament. So it's very important that you pay attention to that fatigue. When your muscles are fatigued, when you feel tired, when you're starting to get the soreness or achiness, or feeling like your joint is weak, and if you continue to push through that, that's when you're at risk of injuring the ligament because the muscles aren't supporting the joint. There's more stress on the ligament. So it's important to pay attention to your body, pay attention to what you're feeling. Skiers are a good example. Remember, it's always that last run of the day where you get the injury when you're already tired and fatigued. So you want to pay attention to that.
Yeah. Well, thank you very much, Dr. Blecher. I know you have to get back to clinic and treating our patients. If there's any more questions that have come in, we'll be sure to come back and answer them in a short while. Or feel free to message our patient care team, and they'd be happy to answer any of your questions. For more information about Regenexx Cayman or the full list of conditions that we treat, you can find them on our website at regenexxcayman.ky. And thanks again, Dr. Blecher.
Thank you very much.
No problem.
Take care.